the MediDerm by BioCell, more than microdermabrasion or intense pulse light, faster and less invasive than a chemical peel or surgical lift. The world's first painless, controlled face peel, MediDerm Laser by BioCell. The information contained in the following video presentation has been provided by Ken Rotzkoff, MD, DDS, St. Louis, Missouri. The keypad on the front of the control unit consists of the wait, run, and fault indicator light panel. There are 3 speeds to choose from with the MediDerm Laser: 3, 6, and 9 Hz. There are also 3 power settings: low, medium, and high. The approximate depth of each power setting is 10, 20, and 30 microns per pass. Clean the face thoroughly to remove all makeup and excess oil from the treatment area. Be sure to dry the face completely of any excess moisture. Any excess moisture left on the treatment area can minimize effectiveness of the laser and decrease spot visibility. The use of an ice pack or chiller to pre-cool the skin will minimize most, if not all, any discomfort felt by the patient during laser treatment. If using an ice pack, pre-cool one area and treat while the patient pre-cools the next area. Be sure to wipe off any excess moisture left by an ice pack. Any excess moisture left on the treatment area can minimize laser effectiveness and decrease spot visibility. Treatment technique. The optimal position of the laser handle is draped over the shoulder for support. The laser should be 1/2 inch to 2 inches from the treatment area and perpendicular to the treatment area at all times. To help keep the laser perpendicular, make sure you are sitting on the same side that you are treating. The use of the provided distance gauge will help keep the laser at the appropriate distance from the treatment area. The distance gauge is not a mandatory item. The use of a smoke evacuator will help reduce the amount of smoke buildup on the laser lens, as well as help reduce any odor produced by the procedure. To maintain optimal performance of the MediDerm laser throughout the procedure, the laser lens must be cleaned at least once during the procedure. It is recommended that the lens be cleaned before each procedure, at least once during each procedure, and after every procedure to maintain effectiveness of the MediDerm laser. If during the procedure you notice a decrease in the effectiveness of the laser, this could be an indication that the laser lens needs to be cleaned. To clean the lens, simply use a Q-tip and rubbing alcohol to wipe the lens clean. Before starting the procedure, select the appropriate power and speed settings based on desired results. Low power, which is an approximate 10 micron depth peel, is the lowest power setting possible while still yielding a light peel. It is completely painless for most. Medium power, which is an approximate 20 micron depth peel, is virtually painless and yields a medium depth peel. High power, which is an approximate 30 micron depth peel, is the deepest peel possible without blistering or oozing. There may be some slight discomfort, but most patients say it is not painful. For more information on power selection, refer to the MediDerm Treatment Protocols and Techniques brochure. To begin firing the laser, simply depress the foot switch. Hold the laser 1/2 inch to 2 inches away from the treatment area and perpendicular at all times. To help keep the laser perpendicular at all times, move the entire arm, not just your wrist. To ensure 100% coverage, a 10 to 15% overlap of the spot is recommended. When treating the periorbital area, slower speeds can be used for more control. Also, remind the patient to keep their eyes closed and gently pull down on the treatment area to get as close as possible. When treating the upper and lower lip area, simply trace the lip lines. Avoid firing the laser directly on the lips. To avoid demarcation lines, simply pull the laser back as you approach the jawline. When treating larger areas such as the forehead, faster speeds can be used. Remember, at faster speeds, it is difficult to move your hand fast enough and still get 100% coverage. Because of this, the pulses are being stacked in the treatment area, and the patient may feel an increase in the discomfort level. If this happens, simply reduce the speed. Avoid firing the laser directly on hair. As you approach the hairline and eyebrow line, simply trace around them. When treating around the nose area, slower speeds can be used for more control. In certain areas where a more aggressive treatment is required, such as age spots, sunspots, or deeper wrinkles, simply make 2 to 3 passes over that area. Be sure to go back and fill in any missed areas to ensure 100% coverage. You may also make additional passes in certain areas for a more aggressive treatment. To help remove any remaining char spots, a cool wet towel can be placed over the treatment area. By leaving this towel in place for several minutes, it will also help alleviate any stinging sensation the patient may feel. After the towel has been removed, the patient will have a pink to red color and have a mild to moderate stinging sensation that may last several hours depending on treatment level. The healing process is 7 to 10 days, again depending on treatment level. Makeup can be applied the day after the procedure to help conceal the healing process. Routine postoperative care includes applying a cold compress, the use of Aquaphor or Vaseline cover for 24 hours, the use of moisturizer and sunscreen. Also, to help the peeling process, which will begin in days 3 to 5, a microdermabrasion can be scheduled approximately 1 week post-op. For more information on the MediDerm Laser, please contact BioCell.